There is always a complaint that doctors are pushing for cesarean section. There are multiple reasons cited. It could be for money, it could be that lack of time. What is your take on that?
It's very easy for a doctor to do a cesarean and go, but then doing the normal delivery, the gratitude what we get from the patient, definitely, as far as I know, nobody will do a cesarean just like that when the delivery is happening smoothly. Nobody will do. It's only for obstetric indication. So when you're having 1 or 2 kids, if you want to have a difficult delivery and then once the baby is come, the baby is in the NICU for 3-4 days, what is the happiness you're getting from just having a normal delivery? Okay, so that is one thing. So from a patient point of view, if they say for money it is this thing, but in fact if you see, the money is the same whether it is normal or it is cesarean. The doctor will charge the same. In fact, if you see all the corporates now, for normal delivery it is more when compared to that of a cesarean. Just only to break the myth that cesarean is not done for money. Cesarean is done because we want the mother and the baby to be safe and have a happy outcome. Not rather than mother is there in the bed and the baby is in the NICU, you can't have your baby next to you. So definitely it is not the thing that for money they push for cesarean or they don't have time. It's not like that.
So when a doctor is indicating cesarean section, there is a reason that
is
either the mother's life is getting compromised or the baby's life is getting compromised.
Definitely. So that's why I told you, people feel they took till the last, they waited and then they did cesarean. She had to undergo this pain and that pain. So then you should appreciate that doctor, that she waited till the end. But as I told, there are 4 factors which will allow us to have a smooth delivery. The cervix should open, normally the cervix, it should open to up to 10 centimeters. So once only that, if it is opening till 4 and not opening, then you can't do anything much to make that cervix open. As a doctor, we can put some medicines. But with that, it's not opening, then that's all. You cannot artificially go cut the cervix, you can't do that. The head has to come down on its own. Nobody can push the head to come down. So if the head is not coming down, then how can you have a normal delivery? The people don't understand when we tell, the head does not come down, that's why we are doing. What head is not come down? It is not come down, it's not come down. Nobody can't do anything about that. The third thing is, the baby's heartbeat. The baby is past motion inside. So you can't do anything about that. Baby is past motion. Within half an hour, if you don't deliver the baby will take that meconium inside. That's called meconium. That's a motion. It will take inside. Once it enters the lung, the baby will have meconium aspiration syndrome. Then it is there in the ICU. Baby will be on ventilator for 3 to 4 days. It's very difficult time for the baby. So any of these indications, I feel, don't argue with the doctor. They have given you the trial now. They have tried their best. So then once it is there, then better to go for a cesarean rather than have a baby in the NICU.
What is one nutrition advice that you will give to the pregnant lady?
Take good amount of protein in your diet. Protein is very essential because especially when we are in down south, maximum our diet is all of carbohydrates. We eat idli in the morning, we eat rice in the afternoon and we eat dosa in the night. So it's only carbohydrate. Protein is very essential. So if one advice, if you ask me, I'll tell protein. If you are a vegetarian, soya chunks and all those things. If you are a non-vegetarian, fish, egg and chicken. Yes. Other than that, multivitamins, if you are asking me, vitamin C rich food and iron rich. So vitamin C, any of the kiwi and all citrus fruits.
I have a question on prenatal vitamins. We are not planning, I'm just asking you.
Okay.
Prenatal vitamins, people start taking it even before conception, 3 months before. Is that what the recommended thing is?
Yes. Because mainly to prevent this neural tube defects, you have to take this folic acid. Mainly it should contain folic acid. But the prenatals, what we get it in US, it has this vitamin A, which ideally we should not take. Vitamin A is not, it's contraindicated in pregnancy. So main thing is folic acid.
Folic acid is the main thing.
Yes.
To prevent the neural
tube defects,
So if there is a vitamin A in the ingredient, it is better not to
avoid,
take it. I see. And how long they should take it? 3 months?
3 months. First 3 months.
After conception?
After conception, continue for first 3 months of your pregnancy till 12 weeks.
So 3 months before and 3 months after. 6 months.
6 months. And then we change to iron. So this iron also will have folic acid. So they get folic acid throughout 9 months. So folic acid is required the whole 9 months. But there's one more myth about this left-right. What mothers will tell their daughters, every time you change the position, you have to sit and then change. But that is a myth. It's not required. So from your left, you can become straight for 5 minutes and then you can turn to the right. Maximum left, but no need to get up every time and then, change the position.
I see. If you sleep on the left, it's a male baby?
No. All pregnant mothers, we tell them to sleep on the left only. So there's no left, right. There's no male baby if it is the position. The shape of the abdomen doesn't indicate.
Shape of the abdomen people consider,
Yes. They say if the abdomen is very much visible, then it's a girl. If the abdomen is not seen at all, then it's a boy. And the funniest part is they'll come with a heart rate. So my patients will ask, doctor, what is the heart rate? I'm like 140, 146. They'll have a eye-to-eye movement. Like, what happened? No, then it's a boy. So that is a myth. The heart rate for any baby is between 120 to 160. So it varies. So today I see 120, tomorrow it will be 160. So today girl, tomorrow boy. How can it be? So there are so many myths.
But there are multiple people who did not proceed with the pregnancy even more than 12 weeks.
Yes.
Right? Multiple abortions happening.
Yes.
Either it could be natural or, that could be they have like bleeding all of a sudden. When they go in, they say that, the embryo is not anymore. What is the most common cause of this?
So most commonly it is something called as this APLA, antiphospholipid antibody syndrome. That's a very common condition. We have antibodies against our own body. So our body will develop antibodies against our own body. So it is called as immunodeficiency condition. So that is one of the conditions. Other than that, then it can be like, sometimes consanguineous marriage can have abortions. Sometimes when you are having thyroid levels are very high, that can lead to abortions. And other infectious diseases, though they're not very common as before, but toxoplasmosis and syphilis.
Some infections.
Yeah, infections. All these things can be the reasons. Sometimes, you will not have any reason. But we'll do all these tests and we'll find all of them are negative. But still you can have an abortion. That is unexplained. So that is one big chunk where you don't find the reason. And then these are the most common. But mostly it is autoimmune conditions.
I'm going to expand on the consanguineous marriage. See, consanguineous marriage means you're marrying within your family.
Yes.
It could be your sister's daughter or uncle's son, uncle's daughter with the first degree relatives.
First degrees usually doesn't happen. From second degree they come. Second degree is a mother's side.
Second degree.
Mother's side. So when you're marrying your mother's brother for a girl, so mother's brother, that becomes a second degree. So what happens, and father's side, usually we call it as a third degree. And then somebody in the relatives, uncles, somebody like that and all, then it becomes fourth degree. So second, third and fourth, most common what I see, especially in Chennai when I see, most of them are second degree. Most of them would have married mother's brother. Yeah, because old at that time and all, they will have mother and daughter will deliver at the same
time.
Yeah.
Correct.
So then most of the time the second degree what we see. So here what happens, sometimes they can have anomalies. So most of the time they'll have these anomalies which their mother may not have, but their grandparents would have had. So it would have been a recessive. So both of them would have recessive. Now when you're marrying within the family, so here recessive and their recessive both combine together, that one baby can get affected with a lot of anomalies, which can be a structural anomaly or it can be any other chromosomal anomalies.
Birth defects.
Yes, birth defects and all. Abortion also can happen in these individuals when they have any of these chromosomal problems. So if we do the chromosomal study and we identify what is the problem, then it is easy for us to change it. Yes. Only problem with the abortion where recurrent it happens, is this autoimmune disease.